Take it away, Morgan.
Folks, I'm Morgan, she, they pronouns. I am a social worker who then became a nurse, who then became a nurse practitioner, mental health nurse practitioner, because I'm a huge dork. And today I'm going to talk with you all, kind of building on the talk back in May about ADHD meds specifically. And within that, we're going to do our best to highlight the experiences of autistic folks with ADHD and how that works with meds. There's a spot in the middle where I'm going to pause because I want to give us all some space to kind of talk about controversies in ADHD medications that there's not really a conclusive research-backed stance on. And then I'll share a little bit about what I do. And then I'm going to ask Mar to resume the recording so people have some space to chat in the middle. Let's do this. Questions are absolutely welcome in the chat. I might miss that. So if folks are willing to just read them off, feel free to interrupt me and just read them. People don't want to unmute themselves. I'm going to ask other people to do that. And I'm going to put Zach on blast a little bit. He doesn't know this is happening, but we're friends. So Zach, if you feel like reading any questions in the chat, or Mar, if you feel like reading any questions in the chat, that'd be super helpful because I can't see them all.
Yeah, I got it. Zach's little sad emoji face is on there. Yeah, I got it.
Cool. All right. So our guest presenter is a neurodivergent celebrity feline who will make some appearances also. So I have a slide here about my biases because I think that's important. This is the same as it was last time. They haven't changed since I talked with you all last. But in brief, I'll let you read this too. Medications are just one part of a whole treatment picture, and they're not right for everyone. And some of the reasons that medications are right for people are because of the social context that we live in. Because we know that neurotype differences are not a problem or a pathology. They're just a normal part of being human. However, we live in late stage capitalism, and sometimes we need help with that. Also, psychiatry has historically been a source of violence and harm in the healthcare system, and medications can be helpful for people. All right. Disclosures and disclaimers, these are mostly the same. I will add the neurodivergent celebrity feline is not my cat. This doesn't substitute medical advice. I don't take any money from pharmaceutical or wellness companies. And like we talked about last time, that's important to understand because the majority of psychiatric medication providers do, about 54%, take some kind of financial incentive per year from pharmaceutical companies. And also helpful to know that the wellness industry is 4 times greater in terms of annual income than the pharmaceutical industry, and you're not required to disclose relationships with the wellness industry like supplement companies or medical device companies. Like an example of that are like some of the continuous glucose monitor startups. So that's all the same. Moving on. We talked about this already. So when does ADHD need medication treatment? I imagine that many of you have takes and opinions and thoughts on this from your lived experience or your experience providing mental health care. It really depends. And it has to be a conversation for the person who's seeking help and what treatments are available to them and the risks of non-treatment versus the risks of treatment itself. So there are many effective non-medication treatments for ADHD, but access to those can be limited. And sometimes that's a place where medication is appropriate for someone who may not have the potentially highest symptom severity, but they can't go get the other stuff. Like they can't afford an in-home occupational therapist. I think all of us would love to help organize their life to better accommodate them. When ADHD is treated with medications, stimulant medications are the first line evidence-based medications. This is because they are far more effective than non-stimulant medications. I'm happy to share slides if folks want them, but this comes up often, and I'm sure that many of you have seen this, where your clients are being told that they shouldn't have stimulant medication first. And what I will say conclusively is that is not an evidence-based practice. It is not an evidence-based practice to tell people that they have to like fail a non-stimulant medication first. There are plenty of people for whom stimulant medications are not an appropriate option, and we'll talk about sometimes what that can look like. But when I hear a medical provider say, I require people to try non-stimulant medications first, that to me is a red flag that maybe they're not the right person to be treating ADHD. I'm not going to spend a whole lot of time here, but there are lots of non-medication ways to treat ADHD. CBT for ADHD is the most well studied. It's not the only option, and it's really dry. I'm going to add in here because people often ask me about this. They ask me about like specific nutrition for ADHD. And there's some evidence when people have deficiencies of iron and zinc that correcting those can improve ADHD symptoms. In general, what I recommend to people is eating nourishing foods with plenty of fat, fiber, and protein because it helps us stay full. And dopamine and norepinephrine, our ADHD neurotransmitters, come from protein. We need amino acids to make neurotransmitters, so we got to eat food. And avoiding blood sugar spikes can be helpful overall with mental health. I always tell folks that there is insufficient evidence to recommend cutting out specific things. Like people often ask me about gluten, dairy, food dyes. My perspective is that the evidence level there is pretty weak. It's observational studies. It's not robust enough to make a conclusion. And the risks of advising restricted diets without a medical indication is an increased risk of developing eating disorders. And anorexia is our #1 lethality mental health condition. And neurodivergent people have a higher incidence of disordered eating than neurotypical people. This is like a controversial area that we're going to talk about more in detail when we pause the recording. ADHD meds, and cannabis. I wonder if folks want to kind of throw a thumbs up in if this has come up for you in your lived experience or your clinical practice. Like, what do we do with this? Yeah. Lots of people. Okay. So it's hard. I don't have all the answers. What I can say is that cannabis use disorder is increasing in frequency in the United States. It's about 8.6% of the total population. And the potency of cannabis has increased exponentially since more states legalized recreational cannabis use for adults. And chronic cannabis use is associated with some changes that may not be desirable for people with ADHD. Those include increased difficulty with memory, increased difficulty with decision making, and difficulty with increased dopamine control. Increased inhibitory control, and decreased dopamine release in the striatum. So all of that can present kind of similarly to ADHD or worsen ADHD symptoms. And I want to highlight that's chronic cannabis use. That's not like I enjoy it with my friends every now and then. So what we do know is that ADHD medications tend to be less effective for people concurrently using cannabis regularly. And that's a helpful thing to talk about. Cognitive effects of chronic cannabis use typically improve after 4 to 6 weeks of abstinence and can improve with reductions, but they don't improve the same way as abstaining. And again, chronic, not occasional, recreational. So cannabis does also have significant interactions with ADHD medications because it increases the liver's metabolism of ADHD meds, specifically a liver enzyme called CYP2D6 that metabolizes amphetamines, Wellbutrin. We'll talk more about that if people have questions. But helpful to know that it's really hard to get mental health medications dialed in right with kind of differing or intermittent amounts of daily use. So that would be like somebody who has kind of an all-day smoking day on Mondays and Thursdays when they're off work, and then otherwise abstains. It can be hard to get meds right. And it's specifically the CBD more so than the THC that interacts with medications, but the THC more so than the CBD is associated with cognitive and mood effects. Um, I imagine that many of you are familiar with this already, but these are medical conditions that can kind of look like ADHD. And important to know that none of these conditions mean that people can't also have ADHD. So, for example, TBIs are more common in people with ADHD, sleep apnea is more common, neurocognitive symptoms of menopause are more, and PMDD are more common in people with ADHD, and development of substance use disorders, which substance intoxication and withdrawal can cause cognitive effects, are more common in people with ADHD. So are we all know our triad neurodivergent kind of, I call them zebra medical conditions, the ones that can be really hard to get diagnosed and really hard to be believed, like MCAS, Ehlers-Danlos, POTS. These all also cause neuropsychiatric symptoms that include brain fog that can cause a lot of difficulty that can look like ADHD and occur more often in people with ADHD. Um, this is kind of hard to talk about because the research stinks, but there are people who misuse ADHD stimulant medication specifically. All of the stimulant medications are labeled with a black box warning for addiction and abuse potential. That's their words, not mine. Um, Stimulant medications are desirable for some people, which can increase the risk of an outcome-driven diagnosis for people without ADHD. So I really have issue with this, but the misuse prevalence in 2025 in the past year for people with ADHD was 22.6%. But the research doesn't define that clearly. And a lot of the time they're talking about use differently than prescribed, but they're only counting use more than prescribed, not use less than prescribed. So I don't know that this is terribly helpful information, but like people do use their meds differently than prescribed. I would love to see like how different is this from like antidepressants? Potentially it's not. I don't know. Um, and then diversion, which means giving your meds to somebody else. Past year, people with ADHD reported 18.2%. The reasons that people with ADHD may be doing this are differing from people without ADHD. So people with ADHD most often cited they want to maintain alertness. And one big example in there was truck drivers. To me, part of that is treating ADHD because treating ADHD involves driving safety. Also, people with ADHD reported giving medication to a loved one, wanting to help them, either with alertness or with their own ADHD. And people with ADHD reported selling medications. Questions, thoughts, opinions on this?
Yeah, I have a question. I know you said like the research is, it's not
Close.
necessarily there.
Yeah.
But have they looked at like ages of quote unquote misuse?
Yeah.
Like I'm wondering about like college students
Great
specifically.
question, Zach. College students are the highest prevalence age for stimulant medication misuse, used differently than prescribed. And this is true of both people with ADHD and people without ADHD. And typically the reasons cited in that kind of early adulthood period, and it's the range is around 16 to 22 or so. And it's the study is hyperlinked that I used for this, so you can go check it out yourself, but that's about right. The most commonly cited reason is for academic performance.
Makes sense. Thanks.
Yeah. Other questions, comments, thoughts? Cool. This is kind of similar to what I talked about last time. We all know that people with ADHD especially have trouble with routines and remembering to do things. I won't talk about this a whole lot because we talked about it a bit last time as well. But I always, when I'm prescribing a medication to someone with ADHD or any kind of executive function difficulties, I talk with them about how are you going to remember to take your meds? Because if you don't take them, they don't work. And if you don't want to take them, that's a totally different thing. But like part of my job is like, I'm only going to prescribe stuff that you want to take, that you believe will be helpful to you, that I believe will be helpful to you. And then, assuming all of that is true, how do we help get them into you? So here are some examples. I'm curious if folks have ones that work well in their clinical practice they want to add too.
think one thing I like to name with my clients is that it is really difficult for a lot of neurodivergent folks, especially like ADHDers, to like make a habit of something. And like it is a conscious, intentional effort every time. And so I feel like a lot of people can experience shame for forgetting, or from other people of like, oh, why don't you just take your meds? And it to know that it's not as easy as that, that like even if you've been doing it for years, like you can still forget to take your meds. And
Yeah.
to like routines and rituals are so helpful and important. And there still is a conscious, intentional effort each time. And recognizing that, I think can then help just with that knowledge, utilize strategies, if that makes sense.
Yeah, absolutely. And I like to normalize for folks, you will forget your bed sometimes, and that's normal for the entire population, and especially normal for people with ADHD. Corey, let us
Thanks.
know what you
I
think.
was just going to jump in and add that I've had conversations with clients, ADHDers, who were really actually kind of relieved to learn and have it feel sort of depathologized, that it is very typical that when you are engaging in routine tasks, it can be difficult to remember if you have or haven't done them, because you don't know, am I remembering taking it this morning or was it yesterday morning? I took them out in my hand to take them, but then I was on autopilot and I don't remember, did I just take it? And so thinking about ways to help support their memory, because what they're engaging in is something that is so easy to forget or to not have been kind of mindfully engaged in the practice of taking your medication every day or multiple times a day. And so for those clients, sometimes talking about a strategy of like using, the little pill containers that they fill for the week or what have you, so you can look and say, are the pills still there or are they gone? And that helps to, once again, helps to provide them that support and less of a mental drain on their memory to actually have been present and remember, did I do this right now versus did I do it at another time that felt and looked a lot like right now, but I'm not sure if it was right now.
Absolutely. I love that one. These are some things that I do. I will leave them here. You can all have the slides if you want them. But I do exactly the same thing. The pill sorter, or they're like stick-on clickers that stick to medication bottles for just a couple of bucks, and you like slide the thing. That can be really helpful because then it's all stuck in one place. With stimulants too, I will often suggest to people, as long as there's not a risk that meds could end up unsafely into a loved one or pet, there are little containers that you can attach to your keys. So if you are a person who probably left home with your keys for the day and you realize when you get to work and you are having a heck of a time focusing on work that you forgot to take your meds, that's when you could go take the emergency pill you put in your keys. Because usually I notice people are good at remembering when they didn't take them. It's just kind of figuring out when that timing was and if it's still appropriate to take their medications, because some of them last so long that if you forget too late in the day, I wouldn't recommend taking them. ADHD and autistic humans. The research is terrible, specifically because for a long time, the DSM excluded an ADHD diagnosis for people who had a diagnosis of autism. So this is an area where there's a lot of kind of navigating this with clinical experience and listening to individual people. Stimulants may be up to half as effective for autistic ADHDers as ADHDers without autism. Autistic people may have lower response rates to SSRI antidepressants versus SNRI antidepressants or other antidepressants. SNRIs are like Pristiq, venlafaxine, Cymbalta. And then some of the other antidepressants that may work better are like Buspar, mirtazapine. Yeah, we'll leave it there. ADHD treatment in autistic people can help with emotional regulation because it's an executive function, which can reduce distress. Any opinions people want to chime in?
Oh, I'm sorry. Would it be possible for you to repeat the ones that autistic individuals tend to have a better response to, even though I know you're not saying? Okay.
I think it's helpful. It's helpful for people to have in the background of their mind. So the resource cited right here is a great book chapter from the Oxford Autism Handbook. They have a whole chapter on meds. So ones that might work better for autistic people in terms of antidepressants, mirtazapine is one, Buspar is one, and then there's some evidence maybe vilazodone works better, and then the SNRIs. Was that too fast?
Oh, that was great. Thanks.
Yeah.
Something I'm curious about, well,
Yeah.
a lot of this, why do you know?
No, we do not. There's a theory that maybe autistic brains do something different than non-autistic brains with the way serotonin acts in the brain. There's some research looking at that with psychedelics specifically. I don't know. Hopefully we will find out.
Yeah, okay. There's just 30 more questions. That's okay. I'll do research. Thank you so much.
The question I get asked a lot about stimulant medications is something along the lines of, isn't that just meth? The answer is no, it is not just meth. It is different by one methyl group. So the name amphetamine sounds really similar to methamphetamine, and I want to call our attention to another example of two chemical compounds that differ by one methyl group. One is methanol, which is antifreeze that causes blindness if you ingest it. And the other one is ethanol, which is the alcohol you find in adult beverages. Two similar names, similar chemical compounds, very different effects in our bodies. When people also talk about like, isn't this just meth? I also call their attention to when we think about chemicals in our bodies, dose and purity make a really big difference. So this is a pharmaceutical grade medication, which means it doesn't have other things in it that are associated with risk. Like when we think about prescribed medications versus meth, one example is like contamination with fentanyl in the meth supply. And the dose is much, much lower than the doses that people are typically using when they're using stimulants recreationally, including when they're using methamphetamine recreationally. So it is not meth. And there is a prescription form of methamphetamine. It's called Diosyn. I have never prescribed it, and I don't know when I would, but it is a thing that exists, and it is FDA approved for ADHD and narcolepsy. So what stimulants do in our brain is basically they make dopamine and norepinephrine more available to our brain. They inhibit two enzymes that help us kind of recycle dopamine and norepinephrine. They're called DAT and NET. And then we'll talk on the next slide a little bit about the difference between the two buckets of stimulant medications, amphetamines and methylphenidate products. They're mostly the same. They both act on those two enzymes, but then amphetamines also increase the dopamine release in the synapse. So that theoretically is associated with increased misuse. And many countries only have legal methylphenidate, like some of Western Europe, Japan is one of them. We'll talk about that. So two buckets of stimulant medications. There are a heck of a lot of trade names and a heck of a lot of different types of packaging of these medications, but basically they all fall into two buckets. So methylphenidate products are brand names Concerta and Ritalin. We just talked about how they're a little bit different in terms of mechanism. There's research showing that they're not associated with mania in people who have bipolar treated and also ADHD. They may have neuroprotective effects long-term. They're often used first line for children because they may have decreased risks and slightly increased efficacy in kids. There is one medication in both of these buckets that's slightly different, that's a prodrug, and I might breeze through that a little bit, but we'll come back to it. Amphetamines, we talked about how they're a little bit different in mechanism. These are trade names. Adderall, Vyvanse, Focalin are all in the amphetamine bucket, and they're slightly different, but it's not a thing I think is terribly helpful to know in terms of differences. They may be more associated with neurotoxicity. This means things like psychosis and mania at high doses. They may be more effective in adults. And then the one medication that's a bit different in this group is lisdexamfetamine, which is a prodrug that's trade name Vyvanse. Cons, there are not large studies about mania and bipolar, So we just don't know. It's because the countries that do the studies that are very large studies are countries that only use methylphenidate. And it may be more associated with psychosis at high doses. Short version here, a prodrug is a medication that when you swallow it, it's inactive. When it hits your liver the first time, it turns into active form. And there's two of those, lisdexamfetamine, which is Vyvanse, and serdexmethylphenidate, which I've honestly never used because it's still very expensive. It's called Asteris. And people, that can work really well for people because it gives a pretty even medication level throughout the day versus some of the trade names here. The extended release forms are kind of fancy packaging around how the capsule works that can lead to peaks and decreases instead of giving you a pretty even level throughout the day. Other perk of prodrugs is that they don't do anything if you insufflate them, meaning snort them, or you inject them, because they actually have to be processed by the liver to become active, stomach to liver to bloodstream to be active. In general, some contraindications for stimulants, meaning reasons someone might not have them, are cardiac arrhythmias or heart conditions, high blood pressure, especially in pregnancy, because that's a risk for preeclampsia, epilepsy or seizure disorders, decreased appetite resulting in weight loss. This would be especially in children, older adults, people with an eating disorder history, previous intolerance to stimulant medications like irritability or tics. The current socio-political landscape of stimulants is rough, as expressed by our celebrity cat. Stimulants can't be refilled by the pharmacy, so it's important for people to know how they're going to get a refill because it's not the same as other medications. That's a regulation that comes from the DEA. Stimulant scope of practice is important to know. Not all healthcare providers in all states can prescribe them. One example of this is in Washington, naturopaths can't prescribe Schedule II substances, which are stimulants, but most all other healthcare providers can, and that can differ state by state. There are states where nurse practitioners or physician assistants and naturopaths can't do it too. Those are not states where I practice, Washington and Oregon. Med shortages are happening, they're getting better. Insurance likes to tell healthcare providers which ones they can use and which ones they can't use. In 2026, it's likely that we'll see some changes from the DEA about requiring people to be seen in person. That's been suspended since the beginning of the pandemic. We have anti-science and eugenicist rhetoric coming from Health and Human Services right now, especially about ADHD medications and safety of ADHD medications. And we live in a context of late-stage capitalism where it's really hard to access accommodations, and the executive function demands are far higher than human brains are really adapted to. So all of these impact kind of our landscape of stimulant medications and prescribing them. Zach, do you have a question?
No, I just finished eating breakfast, so now I'm on
Sounds
camera.
good. Glad you ate breakfast. Well done. Stimulant medication side effects, these are kind of the general ones. They're mostly the same for all of them. Decreased appetite, increased heart rate, and blood pressure are possible. Sleep disturbances, specifically difficulty getting to sleep, can happen. Stimulant crash, which usually what I find is that if we support people with strategies and tools around eating, and great work, Zach, and drinking water during the day, that this is far less likely to happen. Sometimes I have to work with people a little bit on some energy pacing too, because the stimulants decrease people's appetite. And so I have lots of people who say they have a stimulant crash, and then I ask them more about it, and they tell me that they do like a hyper focus 4 hours in the morning without eating anything and only having coffee. And then by the time their meds wear off at 2 p.m., they feel terrible. Anyone who does that is not likely to feel good. So those are things that are great things therapists can support with. Stimulant withdrawal, it's not terribly likely. What that can look like is people notice they feel sleepier and hungrier. Usually that goes away in a week or so if it's going to happen. It's far less common with prescribed stimulants than with like methamphetamine that people are using in the context of a stimulant use disorder. ADHD meds and eating. It's hard to eat with ADHD. It's hard to notice that you're hungry with ADHD, and meds make that harder. So here are some things that I do with my clients' patients, and I imagine many of you are doing also. I'll just leave this here for a second and you can all have the slides. ADHD and sleep, I think, is really helpful to talk about because ADHDers are more likely to have what's called a delayed circadian rhythm, more likely to have sleep apnea, and more likely to have restless leg syndrome. Those last two are medical conditions that need medical treatment and should be screened for by medical providers. But ADHD medications can also make it more difficult to get to sleep, especially in the long-acting versions or if they're taken later in the day. So things here, we talked about routines and habits. These are all great therapist things to help with, is like, how do I help people get able to rest and get to sleep? And then medical providers get to help with, how are we timing medications? Do we need a different kind of, it's called duration of action, how long it lasts in the body? And do we need to time medications differently to help with that? The recommendation that I give my patients who are getting long-acting medications, kind of starting, and then we customize it if we need to, is that I recommend my patients put their medication bottle next to some form of caloric intake or fluids, next to the thing that makes noises that wakes them up in the morning. So if they reach over to snooze that thing, they can take a pill, have a protein drink. They're getting some calories in them for the day as well as their medication. Yeah, melatonin has some evidence here. People like to recommend it. There is some evidence in kids with autism with melatonin, but there is not evidence to support using melatonin for the treatment of chronic insomnia, according to American Academy of Sleep Medicine. My stimulant stopped working. This is something I hear a lot from people too. And how I approach this is I talk with people about, what were we expecting that the stimulants would do? Have those things gotten better since you started stimulant medication? And like, what are your expectations of what you're able to do? Now we spend a lot of time normalizing that focusing at a desk job for 10 hours a day, 8 hours a day is not a normal human thing that we can do. And I, especially when I see like new moms, especially, I'll have people be like, my stimulant medication stopped working after I became a parent. And we talk about it, and we talk about what they're expecting themselves to do. And especially parents of young children are often expecting themselves to be able to focus without interruptions for like 12, 16 hours a day. That's not a normal human thing that we can do. So that's the big thing I noticed. Then also sometimes people, when they first start a medication, notice that it improves their mood a little bit, because it can. And that's not actually a treatment target for ADHD. That's an extra helpful thing for some people. But I wouldn't increase a medication to keep chasing that mood increase. I would do that a different way, because you're going to end up on a riskier amount of stimulant medications, and you're not treating ADHD at that point. So what I do with my folks is, when we have this conversation, I say, okay, let's try just stopping your medication for a week and see what happens. And if you notice that it's no different, then absolutely your medication is not working. What usually happens is that people stop their medication for like 3 days and they're like, oh, it was helpful. I just got used to how helpful it was. Controversies with stimulants. I'm going to leave this slide here, and then I'm going to ask Mar to pause for us. All right. I'm just going to leave this here. I'm going to highlight that amphetamine medication specifically, that's the Adderall type ones, don't absorb from your stomach if your stomach is more acidic than normal. So many ADHDers like to have a black coffee and their Adderall for breakfast. They are not getting their full dose of their Adderall that way. And that can be really helpful for a therapist, for an occupational therapist, for a coach, to talk about like, can we get some other things into your stomach? And I'm not saying that you can't have coffee with your breakfast, but like, let's put some other things in there too, so your medication absorbs better. Strategies for taking meds. We talked about all of this. Moving on. ADHD treatments that are non-stimulants. Here are a couple. These are the most common ones. People also do some like way out there stuff that I'm not going to cover because that is something that you would see a mental health specialist medical provider for. There is a medication that we're all going to hear about a lot more. It may be FDA approved as soon as the end of this year. I don't know how to pronounce it yet. It is a norepinephrine, dopamine, and serotonin reuptake inhibitor. So that's kind of like bupropion or Wellbutrin plus an antidepressant. It's looking quite promising in the clinical trials. Stay tuned, but I'm just mentioning it because I imagine people are going to hear about it and maybe they'll want to try it. And it's probably going to be super duper expensive and really hard to get because that's how insurance works in America. Clonidine and guanfacine are two non-stimulant ADHD medications. They both work in a pretty similar way. They decrease the body's fight or flight response. What they do is technically they decrease the norepinephrinergic sympathetic outflow. So basically they turn down your fight or flight response. In ADHD, they can help regulate the prefrontal cortex where our executive function lives. We don't know exactly how that works. Guanfacine may be more effective for autistics with ADHD, but those studies are primarily in children. Both of them can cause low blood pressure. They've both been studied, but are not approved for treatment of rejection-sensitive dysphoria because RSD is not an official clinical diagnosis. So it's hard to get anything approved without an official diagnosis. And then clonidine also has additional evidence for PTSD nightmares, although it's not used first line. These meds, because they lower blood pressure, can be for people with ADHD and POTS. We got to use these carefully. And people who just kind of already have random low blood pressures, like they stand up and feel dizzy all the time, these may not be a good medication option. But if you stand up and feel dizzy all the time, that needs to be checked out if you're drinking water. Any questions on these guys?
None on this, but there was a question from Zach in the chat of taking multivitamins also decreases stimulant absorption if taken at the same time, correct?
It's specifically the vitamin C in there, but so there's like some relationship with vitamin C and making the stomach more acidic, but also maybe it has something to do with dopamine breakdown that's not well understood. The vitamin C doses in multivitamins are not huge. I don't terribly worry about that with people. I'm like, especially if you have food sensitivities and you're not comfortable eating a wide variety of foods, like take the vitamin, take it with food, take it with your medications. Just do that thing consistently rather than like doing it differently different days, because then potentially your dose is changing day to day. Good question. I decided to put in animals that are the vibes I think these medications have. So I think these medications are kind of a tortoise vibe. I use them often, especially with my AuDHD patients. Often people tend to find them really helpful. And what they'll tell me when they take them is like, it feels like my brain quieted down. But they don't notice, like, I feel kind of like a jittery focus that some people notice with the stimulants.
We have another question in the chat. Is there ever a time where guanfacine or other non-stimulants should be paired with a stimulant medication?
Great question. Should is really hard to answer because it depends. What I will say is they are often paired with stimulant medications. And the reason that someone might do that is if the stimulant medications have been effective and the kind of remaining ADHD symptoms that someone's looking to treat, either because stimulant medications didn't improve those symptoms all the way or because someone can't tolerate a higher dose of the stimulant medication, would be like rejection sensitivity. Often I will think about this in somebody who has both ADHD and PTSD, especially if they're having PTSD nightmares. If I'll think about these with somebody who has ADHD and anxiety, and their anxiety is like a lot ADHD-like it's a hyperactive mental anxiety picture. And often these are used for people with ADHD who have sleep difficulties because they can also both help with getting to sleep by kind of slowing down that fight or flight response and slowing down the brain. And also way off label, there is some evidence for using both of these for people who have a history of mild to moderate traumatic brain injury and sleep difficulty. All right, I am using lots of time, so I'm going to speed up a little. Neurodivergent folks have more medical conditions like Ehlers-Danlos, POTS, MCAS, fibromyalgia, PMDD. And this impacts how we think about medications. So stimulant medications may not be as well tolerated in people with EDS, Ehlers-Danlos specifically. The people with MCAS may react to the non-active ingredients in medications. That's just something to kind of be aware of and look out for. POTS, people with POTS can get stimulants. Sometimes they're helpful. They can get clonidine and guanfacine. Sometimes they're helpful. It depends on the flavor of POTS and the individual person. So that's like, see a specialist, medical provider who knows about this. There is an increased prevalence of seizure disorders, especially in autistic people, and eating disorders. And so those are considerations with medications too. Next medication, atomoxetine Strattera. I think it's a raccoon because sometimes it works great. It gets prescribed a lot. It gives people so much nausea, and raccoons, yeah, they're just popping out. So this medication, it is effective for ADHD. It has a fair bit of safety evidence in pregnancy, and it has specifically some evidence for ADHD and PTSD. What I find is that some of my autistic ADHDers actually really like this medication. It's often preferred for people with a history of substance use disorder or substance misuse. This guy, primary care, like people love to prescribe this and say like, oh, we have to trial non-stimulant medications first. And that is where I have beef with it. Bupropion or Wellbutrin, this, again, another one of those that people just love to prescribe instead of stimulants. There is a reason to do it. It may be more appropriate for people who have like ADHD and depression. Autistic people, and again, most of this research was done in children, are more likely to have uncomfortable activation than non-autistic people with bupropion, which can feel like being kind of overactivated, caffeinated, jittery, uncomfortable. It's also FDA approved when combined with naltrexone for smoking cessation and weight loss, which might be another reason that you see it. Can increase the risk of seizure, so typically not used for people with an active eating disorder, especially if they have purging, or alcohol use disorder, because they increase risk of seizures too. This medication, Quellbry, it's not yet generic. Most of the other ones I've talked about in here are. I have seen no research on this with autistic ADHDers, none. It is basically an antidepressant. It's been used in the UK and EU for depression since the 70s, but in the US it's only FDA approved for ADHD, which is a bummer. And this one can be hard to access, even though it's actually really cheap medication because America. It may increase the risk of suicidal ideation. The highest risk for that is people under 25, and that's a warning that's on all antidepressant medications. It's not specific to this one. But if somebody can't tolerate stimulants, they're also having mood or anxiety symptoms, this might be reasonable. Supplements in ADHD. I don't think that recommending supplements is different than prescribing, unless you are trained in that, like dietitians have training in this. And I'll amend my statement here. I didn't include dietitians, and I should have. Dietitians have training in supplements. Effect sizes for supplements are in general smaller than pharmaceuticals, and they also have risks, and supplements in the United States are not regulated for safety, and that they are what they say they are. So some people may prefer them. When I have folks who really haven't tolerated medications well ever, this can be a great option. The strongest evidence is for omega-3s, and there's a specific ratio of the components of the omega-3s that has the best support for mental health. There is some evidence for a bunch of these herbs. I've listed them out if you want to look them up. You'll see things recommending zinc, iron, and magnesium supplements. Those should be done with a medical provider. If people supplement a lot of zinc, they can throw their zinc to copper ratios out of whack. And zinc and iron, you can actually get too much in your body that's dangerous over time. Questions? Cool. This is my loving note. Therapists, please be careful that you are not promising your client that they can definitely have stimulant medications, because there's a lot of reasons that we've just talked about why they may not be a candidate. And it can set people up for having a difficult relationship with somebody who is doing their best to provide them effective care. And if they're saying categorically you can't have stimulants for no reason at all, you may suggest someone get a second opinion. A medical provider is also likely to do some of their own ADHD assessment. That's not an indictment that therapists can't, although as all of you know who do this, there are some wild ideas out there about that. But I will do a fair bit of my own assessment, but I do love having someone else's report so I can look at the values and kind of what they saw, and it is helpful to me. But part of why I do that is I want to know what symptoms of ADHD we're trying to target together, and it's my license. And so I need to know that I'm treating what I think I'm treating and I'm treating someone safely and appropriately. Finding a psychiatric provider for ADHD and autistic people is rough. I wish there were more. I'm working on it. I started a group that if you find cool people, send them to me and they can join my group. And I am happy to share my referral list. It's Washington, Oregon providers if people want it. Here is a table that I made to help you to figure out who knows what they're doing. So you can all have these slides. I have questions on here about, and we've talked about most of them, about things that are green flag of somebody who's listening to their patients and knowledgeable, and somebody who, if the care isn't going well, it might be worth getting another opinion. So one thing I'm going to highlight here is that a lot of psychiatric providers, and I'm going to put my colleagues on blast here, nurse practitioners especially do this, really like these proprietary, non-validated, non-peer-reviewed continuous performance tests like QB test or cryos. This is not congruent with the current evidence base. So that for me is like I'm not sure about you. Anybody who thinks ADHD, like a lot of these, you know. Yeah, questions?
We have somebody in the chat that says, for an AuDHD child with RSD and nervous system activation, does it make more sense to advocate for starting with a non-stimulant option like guanfacine versus starting with methylphenidate?
Ooh, interesting. I treat adults, so I'm going to defer that to the pediatric provider of this person. How do I want to answer this? Stimulants in general, if we go back here, for kids, oops, are the first line treatment. I lost track of where I am. So that is the thing that I would think about there. If it were me in my life where I was a social worker who was not also a nurse and nurse practitioner, I don't think I would have advocated specifically for medication. I would have advocated for, like, how do we make sure that you're heard? How do you have an informed consent conversation? And how do we make sure that you are really clear on the specific symptoms that you're hoping would improve with medication? Does that help? I'm going to pull this off because that's the end of the slides. But if people have questions and want to ask them, cool. I also went over time and people may have consults questions they want to ask.
I didn't receive a consult.
Okay.
Unless somebody has one that they would like to go over, we can focus a little bit more time here.
I see Samantha saying it's hard to trust medical providers. I totally agree. I absolutely totally agree. And it sucks. folks who want my list of people who are in my consult group, I'm going to throw my email into the chat. Please send me an email. I also do 2 visits a month for a half hour with people who do not prescribe medications, who just want to ask me their questions. If you want to do that, also email me.
One question I have is like,
Yeah.
well, I saw it on Instagram, so I didn't follow it back to its like research study origins. And I just tried to do a quick Google search. But I saw something that said that like stimulants with an ADHD brain, especially like with kids, can have like neuroprotective effects of
Yeah.
like improving brain structural abnormalities. And from my quick Google search, this is from 2025 of Minnesota neuropsychology, and there is a National Institute of Health study on it from last year. So I'm curious if you have any information about that, or if you know about that.
That is consistent with my understanding also. I don't know exactly how it happens. And my guess would be it's a combination of stimulants make it easier to do the behaviors and potentially something of the medication itself. But yes, that is also supported by research. And there's some research that came out last month looking at how stimulant treatment decreased incidence of suicide in people with ADHD as well. And that was on adults. Is everybody's brain full?
It's so stimulated. Anybody has any questions, you're welcome to ask them now. You're also welcome to send them to admin. I honestly don't know what we're going to do with them. I said that automatically, but
you can email me.
There, that's
if I can, feel free. If it's something I can answer in email, cool. If it's something that's going to be really hard for me to answer in email, I'll say, let's just have a chat. Comment on the absence of hedgehogs, Zach. I will do better next time. I apologize. I failed
Thank you. Especially since you promised me that this presentation would be full of hedgehogs. I
put your cat in it.
You did. That's true. That's almost better than hedgehogs.
Well, I'm going to go ahead and stop the recording now.